Good morning, happy Friday. We're back at Epiphany Health with Dr. Lee Gross. I'm Dr. Bill Crouch. Ann is here holding the phone, hopefully
not wiggling.
Not upside down. So we had a pretty productive week up in Tallahassee. Can you?
Yeah, it was a big week. So last week we already told you about how our legislation had stalled in the House Senate Appropriations Committee for a month. We sat there for a month without getting on the calendar. Did a big social media push in the last 48 hours, and happy to say that after that push, we're on the schedule. We finally have a date in our last committee slot in the Florida Senate. So we've passed the Florida House. We're now on our final committee stop. Next Tuesday will be heard. The next step after that is a vote on the floor of the Florida Senate. So we are one step away.
One step away. So again, this is the year we're going to push this across the finish line. Thanks for all your help. And we're also going to talk a little bit today about something that's near and dear to a lot of our hearts for us in this community, and that's the prospects of Northport getting a hospital finally. And I've been observing our efforts for the past 10 years, but your history even predates that. You kind of go back to the beginning. So can you give us a little history of the city's efforts on trying to get a hospital? We have a community with over 60,000 people and no hospital, so I think it's time. So
at 110 square miles, Northport is the largest city in the state of Florida that does not have a hospital. And when I came here in 2002, we had about 22,000 people, and in that time, we've grown to over 60,000. In 2004, we took about 19,000 letters of support to Tallahassee to ask permission to build a hospital. And after long fought-out court battles, we ultimately were turned down. We were denied a hospital. And we have this process in the state of Florida called Certificate of Need, which basically means you have to ask permission from your competition in order to compete with them. It'd be like Burger King having to go to McDonald's to ask to put a restaurant across the street. If I want to put a hospital in Northport, I have to ask all the surrounding hospitals, and if they don't like it, they can block it. That is an archaic law that only exists. It still exists in 35 states. Florida is one of those states. So anyway, that Certificate of Need process blocked our hospital in 2004. We again applied in 2016. Were blocked in 2016. At the same time, the state approved Sarasota Memorial to build a hospital on Laurel Road, approved Venice to build a hospital on Jacaranda. So now our city of 60,000 people is completely barricaded in by competing hospitals, but nothing within our city limits. So our residents have to drive 30 minutes, maybe sometimes even an hour, depending on traffic and snowbirds, to get medical care.
Yeah, I know, again, a lot of people in our community, Sam George, I know you're listening. There are a lot of people that have been working hard on these efforts to try to bring a hospital to our community. And there's a few things we think, or I think, that you can do if you live in Northport. And one is a lot of us, seek care outside of our community. But I would encourage you, if you see a specialist or a physician who has a Sarasota location and they also have a Northport location, you should insist on using their Northport location. You should insist on seeing that specialist here in Northport when they have a Northport location. And when you have a physician outside the community that doesn't have a Northport presence, you might ask them when you go, are you coming to Northport? And they may not currently be coming to Northport, they may not have intentions, but if they decide down the road to add a partner, add a specialist, they might decide they do need a Northport satellite office, and that will help us grow the medical community. So vote with your feet, vote with your dollars. If you want Northport to have more care options, then you should pursue the options that we currently have. So again, if you have a specialist and he only spends a half a day a week in Northport, you need to be here. You need to support that doc in his efforts to grow and recruit more docs to this area, because ultimately we have to staff the hospital. The city would have to help fund it, whatever that would look like. It's going to be an ongoing process, but there is some history here that you're familiar with, and we'd be happy to talk with anybody that's interested, because
what a lot of people don't know is that we built that Northport emergency room. So when we were turned down a hospital in 2004, we were the emergency room. People were coming with heart attacks and strokes to our doorsteps. And so, when we went to Tallahassee, we basically said, look, you're telling us we can't have a hospital. We need care. So we ended up building a medical office building that we ultimately partnered with Sarasota Memorial and converted to a freestanding ER. But we need so much more than that. That's just a step. We need surgery to be able to be done, within our communities. We need, again, all the specialists, everything that Dr. Crouch just said. I guess one last point I would make is talking about the certificate of need is, we keep going back to the Florida legislature. There's a bill that just passed the Florida House on Monday or Tuesday that overturns the certificate of need process. It actually repeals it. That same bill, again, is sitting in the Senate. It's been there for over a month, sitting there stalled. I don't think it's going to move this year, but we're putting on a conference in Washington, D.C. in June where we're bringing in all the key players around the country that are focused on the certificate of need process. And we're gathering to try to come up with a plan, and hopefully maybe we can fix this next year. So lots of exciting stuff going on.
Very good. Well, thanks again for all your efforts. Thanks for those of you in the community that are, again, working hard for us to bring a hospital to Northport. I think it's going to happen, but we just need to all pull in the same direction. Check in with us next week. Thank you so much.
Say goodbye, Ian.
Goodbye, Ian.